afternoon. Yeah, good afternoon, everyone. First of all, I want to acknowledge the people of Kulin Nations in whose land I'm today speaking, and I pay my respect to their elders, past and present. Today, I'll briefly review a WHO tool for benchmarking ethics oversight of health-related research involving human participants, and some potential implications for a certain context, because later I realized that maybe I'm not the best position to explain potential implication for Australian context as a person recently moved to Australia, but I keep this for you maybe and comments, and we can think about it later. I need to declare that I was a member of the expert group that advised WHO to develop this tool. This is my kind of interest in this regard. As a background, WHO is an international and intergovernmental organization, UN agency that wants to help its member states. And as most countries have established some sort of system for ethics oversight of research, WHO published the first standards for the functioning of research ethics committees and research ethics system in 2011. And we don't know really what happened according to those standards. But a new movement happened when WHO Global Benchmarking Tool, which is a tool for evaluation of national regulatory bodies or agencies like FDA, TGA for different countries, which is one part of WHO, important WHO function. And one aspect of this GBT tool is clinical trial oversight. For this injunction project between this regulatory part of WHO and the ethics department, a tool for benchmarking ethics oversight for health-related research with human participant was developed. And this objective were to assist in evaluating the existing capacity to provide appropriate ethical oversight, which is a part of WHO program for monitoring different countries' capacity for national regulatory agency capacity for drug development and other things. And it's very important for many countries how WHO rank them and which grade WHO give them. So it's important and sensitive for Minister of Health and national regulatory agencies in different countries to guide the development of recommendation to address the identified gaps. And also this tool could be used for capacity building and to promote policy convergence and best practices in research ethics oversight, and also to enhance public trust in health research. The scope is it could be used for individual research ethics committees, research institutions, and also the governing bodies and at the national or state level or oversight bodies. The process of developing this tool was expert opinion, expert working group for around 1 year work on this, and some consultants, WHO consultants, and public consultation at the end, as well as 5 episodes of piloting this in different countries. The tool itself consisted of 7 categories, and these 7 categories have different level. For example, the first category is a kind of national or state level category. 2 to 6 categories are research related to research ethics committee, and category 7 about the research institutions. And each category has different indicators. And finally, I can show you how it looks like. Each category, we have some indicators, and each indicator has objective, indicator description, evidence to be reviewed, and rating scale. So the first category indicators are related to assessment of the legal and regulatory context. Some examples of this that could be relevant to Australian context are, for example, legal provisions that require health-related research involving humans to be reviewed and approved by the ERC. That I think that the national statement and other legal and regulatory documents in Australia have this, or legal provisions that ensure that an ERC decision not to approve a study cannot be overruled, except in cases of abuse of authority as determined by a regulatory agency or court. So the independence of research ethics committees, and also updated publicly available information about such regulations. These are some basic part of the category 1. Also, there are some indicators related to authority of research ethics committees that, for example, indicator 11 points that national, subnational, and multinational local oversight authorities support research ethics committees and ensure that they adhere to applicable ethical and legal requirements. Then it requires a kind of national oversight system for research ethics committees. Another important issue I think we can think about that in Australian context is the requirement for registration and accreditation of research ethics committees. There should be somewhere available this information, how many committees are in one country and what are those committees, and also the legal provisions to suspend or revoke the registration of research ethics committees. That registration is a base for this kind of revoking the registration as well. There are other indicators in this section about legal provision that requires research ethics committees to continuing their oversight of research projects and continuing review, about suspend or termination of health-related research. These issues should be, according to WHO, protected and should be supported by the legal domain in the country. There are other issues about requirements about, for example, legal provisions that require research ethics committee members to declare conflict of interest, or legal provisions that establish minimum standards for research ethics, archiving of documents, or legal provisions that make institutions with their own research ethics committee responsible for ensuring available resources. There are also other requirements, for example, legal provisions that require research ethics committees to review proposed research to determine whether it's consistent with the ethical standards in WHO standards. It means that there's some substantive requirement. It means that any country, any state should have a number of list of documents, binding documents that cover what WHO expects ethically from research. And also post requirement for access to medical treatment or compensation because of possible injuries because of research, and also clinical trial registration. These are the first category. In second category, indicators for assessment of individual research ethics committees are mentioned. Category 2 relates to research ethics committee structure and composition. So the composition should be compatible with international documents. The role and responsibilities of research ethics committee members should be there. Members as chairs should appointment for a fixed term, and members and chairs may not be removed before the expiration normally. The research ethics committee need to invite relevant non-members. And the third series list of categories are about REC resources. Generally, they require for sustainable resources for RECs. The fourth category are about REC procedures. Some of them are so important: need for written procedures, need for clear guidelines for submission and screening process, and adequate timing, timely decision-making process for fast-track review during public health emergencies, and also monitoring ongoing research, and a good document management system. The next indicator is about mechanism to promote Research Ethics Committee transparency and accountability. An updated list of Research Ethics Committee members should be available for public, the source of funding, and a list of title, principal investigator, and dates of approval should be available publicly or on request based on the jurisdiction. People should be able to ask questions, should be able to complain about the Research Ethics Committee decisions. The next set of indicators are mechanisms for Research Ethics Committee to monitor their performance. It includes external review, internal review processes, and obtaining feedback from different stakeholders. And then the next category is related to research institutions. Again, in this, there are 5 different indicators. For example, the institution need to verify that all proposals for health research involving human are submitted to a registered Research Ethics Committee, and this issue of registration is a continuing ongoing theme across the document. The institution has policies and procedures for declaration and management of conflict of interest, and for non-members who participate in this, and also for research possible case of research misconduct. There should be some policies, and there are some details about each of these indicators in this guidance. The resources should be transparent, and also the process for investigation, allegation of ethical misconduct should be transparent. And finally, the legal support for Research Ethics Committee is also important, because in some countries, Research Ethics Committee could encounter legal cases against them. There are various options. This guidance has a user guide that explains how this could be used for self-assessment, for collaborative assessment, or peer-reviewed, nationally coordinated assessment, and external assessment. Nowadays, this tool is used for assessing different research ethics environment in different countries. WHO actively do this, and also some countries started to use this tool to evaluate the research ethics environment in different Research Ethics Committee institutional and national level. I need to acknowledge and thank my friend, Professor Dr. Andreas Reis, who is the co-unit head of Health Ethics and Governance in WHO, who led this project with some other colleagues in WHO. Thank you so much, and over to you.